So this, unlike most of our appliances, is dealing with the autonomic nervous system that affects everything: heart rate, blood pressure, sweating, smell, taste, moisture, saliva, and mucus. It's just got to be factored in to our work, because we're working with it whether we like it or not. It's there, it's automatic. We're fearfully and wonderfully made, and that system is how we function. We don't think about changing our blood pressure after we are sitting with a patient for an hour and stand up. If it wasn't for the autonomic nervous system, we'd pass out. I haven't thought about how many times I've blinked, but that keeps my eye from drying out and spit coming in. So you can change these parameters more than we ever thought by these appliances, or our dentistry, or lack of dentistry. Imagine what happens then when we take a lot of teeth out, or put teeth back, but say don't put the second molars in there. Why'd God put those in there? Well, you start seeing these patients and you realize that all of this stuff, even that central groove and the first bicuspid versus the size of the second bicuspid, has a big plan for a balanced balancing the oral system, affects the balance in the rest of the body. That connection is between the health of the mouth and the health of the body, goes far beyond the bugs. And I will hold this flag up as long as I've got breath, is that there is more to this than you could ever even imagine or we know right now. And you got the keys to the kingdom right in your hands, and what you're producing in people's mouths. So you want a smart appliance. You want something that really dentistry, and only dentistry, can manage this. And this kind of appliance looks like almost this phone, but it is not. And the reason is because you take time, effort, and energy to actually learn how these contours affect it. One of the problems that we have is that we've isolated the mouth from the rest of the body, and then only recently have started seeing that, whoa, wait a minute, there's a connection. So think of the heart. One of the most profound things is that when you adjust this appliance on my body, my blood flow changes in the carotid and the jugular, my heart changes, and also my thinking changes. And my mentor and the man that developed all of this should get credit, is Dr. Farron Robinson in Tacoma, Washington. And one day he had us get shells of our teeth. And so we were asked to take that shell and make a heart out of wax on the back left side with our eyes closed. We had blindfolds. And we carved out a heart on a plain shell. Now, you can take a little pulse oximeter that has the heartbeat and the oxygen level, and say my oxygen level was down at 94 or 5, and my pulse was 80. Usually it's 70, or the average. So now we wax this up, and then he said do it on the other side, and then put it in your mouth. And then we took the pulse ox and looked at our pulse and looked at the heart rate. And then he said, on the left side, make the bulge bigger on number 18 as the tongue comes in, it will hit that and move over to the right side, so then make less of a bulge on number 31 lingual. And all of a sudden we started getting differences in our heart rate and our oxygen levels. And if you chose to, you could do this with blood pressure, you could do it with skin temperature, you could do it with a lot of different things. And then he gave us this thing. I still got it. It's a little beaten up, but I'm proud of it. If you put this on this smart appliance and lay it here and carve that bulge, which is the right side of the heart on the left side of your mouth, and a lesser bulge because of the left atrium being smaller over here, the anatomy starts looking like a real heart. There's the apex of the heart, there's the bulge, there's a bulge, and this is what I call the Dolly Parton cleavage between the two major teeth. I'm giving you the keys to the kingdom. I don't want to leave this planet without you understanding that you're going to directly affect that person's heart, whether you know it or not. So it'd be better to know. And the things that you can do with that are unbelievable. You're not responsible for what you don't know, but unfortunately you now know that. And you should question it. Because if that tongue comes in and can change heart rate and blood pressure, which we are amazed at the impact of that tongue on the autonomic nervous system, on heartbeat, on blood pressure, AFib, PVCs, a lot of this stuff is very much tied up to how that tongue comes in and is swaddled. It will change dentistry, change medicine. You've got the keys to the kingdom. What's interesting is this is the left side of the mouth. If you flip it over, the bulge becomes the other way. The lesser bulge is on the right side. And then the contour, the big contour, is on the mesial lingual of 30. So what you have is the tongue comes in on 18, bounces over on 31, bounces over on 19, and then over onto 30, up and into the mouth. So you're driving the tongue out of the back of the throat, up into and on to these contours. When I don't have this thing in my mouth, first thing that happens is I start clearing my throat. That's a cue for the staff to tell me to put my appliance in, because they know I'm going to get a little frosty later when things start happening and things don't go the way that they should be going. I've got a lot more leeway. I'm not living in adrenaline. Because what happens is when you're living in adrenaline, you bend your head forward a little bit and you change your posture. And we were experimenting yesterday with a lady that has Parkinson's disease, and we had two appliances, and she had her legs crossed and her body all twisted, sitting in the chair. And we put it in, and the cardiac nurse, Renee, said to me she's crossing her legs to compensate for her tongue not coming in over number 18. So I cut the top of number 18 down a little bit so it didn't look like Mount Rainier, and shortened it. And when the tongue came in, after I put the appliance in, she immediately took her leg off and set her feet on the floor and put them both in the same position. So then we inserted the second appliance in that still had the Mount Rainier look on number 18. She couldn't get her tongue over there. She immediately crossed her legs and torqued her body, because that's what felt good and how she functioned. Sleep on that for a while, because what you're talking about is the whole physical makeup, but also the psychological, emotional makeup has a lot to do with what we're doing, because the body's trying to compensate. And so, again, it's all interrelated. You can really, my wife and I had knockdown, drag out fights to the point where she says, "Are you wearing your appliance, or am I arguing with your adrenaline?" Because she's a counselor in a crisis pregnancy center, these gals are all adrenalized and scared to death and having all kinds of trying to make a decision with full of adrenaline. And my point is, it's hard to talk to somebody that's their brain's about to explode with all of the consequences of their dilemma. One way or the other, it seems overwhelming, and they're panting and they're butt white and their muscles are tight and their necks hurt and their head's bent forward and they're not sleeping good. And then, you put an appliance in, they've still got their problem, but it is not the physical dilemma that they had before. Now they're sleeping a little better. You can talk to them and they can concentrate and they can weigh all the choices that they have. So when we're dealing with a person that has a learning issue and you put an appliance in and the learning issue goes away, we better start looking at that. And the first organ, and the easiest organ to look at, because you don't have to be buying a whole lot of equipment, is how's that body responding? It'll do everything to maintain a higher oxygen to the point of a heart attack. It'll increase the blood pressure. We were having dinner one night in Tacoma, and one of the docs got a call from a patient that had actually been to one of his little table clinics, and he talked about the fact that heart rate could be a very big thing that the appliances could help with. Now, she didn't do anything about it, but she was in a small town hospital with her nurse friend, and her pulse had been 130 all day, and try as they may, they couldn't get it down, and wanted to move her to another hospital for a pacemaker. And the nurse said, I'm a little alternative, and I think you said to this doctor that it could be done without a pacemaker sometimes. And is there anything we can do? Because they're afraid she's going to have a heart attack at 130 beats a minute instead of 70. That's almost double. And he said, yeah, you got some Kleenex. And she tore a Kleenex in half and rolled it up and made a spitball on each side, pushed the jaw forward in the forward position, and called him back in 45 minutes. They were checking out of the hospital. Now, with that kind of knowledge, how many lives could be touched, just like my wife's before surgery, if you knew how to fix the problem so that the physicians were happy with it and more than happy to take them off the medication. They don't know what to do. They need you. They need you to tell the world that there is a better solution than just 30 prescriptions, half of which are to counteract the side effects from the first 15. And listen, when I had a kidney stone attack, I don't like surgery, I don't like drugs. I was screaming for Dilaudid, and they could cut me open right there in the emergency room, waiting room. There's a place for it. But I'll tell you, if you can calm that person down with an appliance and get rid of the pain, and we were thinking of this, sleep, snore, and so much more with one of these appliances. It's the smartphone of dentistry. We make this already, and we got some really primitive ones out there that look like they came from the Spanish Inquisition. But there are some smart ones out there now with the contours and functional balancing that brings the body into harmony, and it is more than miraculous. We are so unaware of how fearfully and wonderfully we're made. And this is it. The first thing a CPR is check the airway. That's the last thing we ever do. Is how's the dentistry checking affecting the airway in a functional way? So this allows us then to make an appliance that has the contours. Now this is me. I had a root canal tooth removed, and I just didn't have a bridge. I had appliance put in. So this appliance now, when the tongue comes in, fills in that void like a bridge. I mean, I could have a bridge, but you better make that bridge so that it guides the tongue where it needs to go, or I'll be a basket case. I mean, literally, Dr. Robinson saved my life. I had a lot of serious things going on with my heart, which were corrected. and a lot of emotional, spiritual problems as a result of living in adrenaline all the time. And it affected my marriage, it affected my relationships with my staff, and all that got better. I'm still crazy. But it isn't because I'm full of adrenaline, and it isn't because I can't breathe. And I sleep better. I'm 74. I'm drug-free. and I'm enjoying life. Actually, I just started a whole nother practice. And it's only because things are in balance enough so that I'm functioning better than propped up by a bunch of things treating symptoms. So we've got this, Joan made this beautiful analogy. The tongue is really supposed to sit. This is a full 4 bicuspid extraction. This is the mandibular cast. The first bis have been removed and everything has been wrapped around. Now that, see how good that did? It scrambled back up anyway. But the patient had the orthodontics done. My granddaughter just had it done. 3 dentists, one of them were on the dental board in California, all agreed there's no room. She will have to have an appliance. My smartphone just told me that there's some message here from the lady who's trying to sell my house, and this phone couldn't do that. She couldn't even get me right now. This is how the tongue lays. Now, you've heard a lot of things about where the tongue is supposed to be, and I think most of it involves having the tongue forward and on the backs of your upper front teeth. Well, if it is, it's also touching the edge of your lower teeth. It's laid out there. It's not diving down under behind. That wouldn't be behind the front teeth anyway. But to get patients in here, you have to have some space. And when they took out that tooth and that tooth, there was not enough room, so the tongue gets trapped. It comes in and it's got all these what we call scallops. We're going to show you a picture. When you see those scallops, you got yourself somebody that needs to know that, I mean, they don't know they're choking. It's like the frog in the water. They just, life keeps turning up the heat. But those scallops are your diagnostic tool. And you start looking at patients in their head position and their body position, you realize what the tongue isn't doing or is doing. And those tori, it's just God built a system to try to compensate and give some skids for that tongue to get up there. That's pretty good, but you can actually facilitate the tongue getting up with an appliance like this. I have those tori, but not as bad. And I don't have first bicuspids. I have a 6-year molar missing. But the deal is, when this bicuspid was taken out, a whole passel of other problems could occur. Not that they always do, but statistically we know that those first bicuspid extraction patients, especially ladies, have some TMJ problems. And all they're doing is clenching and grinding, trying to open up that throat. Now, I had another kind of problem, though, that I will share with you. Look at how flat those teeth are. And I went back to the dental school after I graduated and told my professor, Crown and Bridge, that I was doing this grinding and pushing my jaw forward. And he said, "Oh, you're just a type A dentist." And so he ground on my back teeth, and I walked out of there pushing my jaw forward like I told him I was. He thought it would quit it. So I went to Georgetown when it was a dental school, and they said the same thing. We just need to grind on your back teeth. Well, they ground on my back teeth, and I still kept pushing my jaw forward. And I went to a lot of gurus all over the country, and a lot of money was spent trying to get TMJ appliances in, and I appreciated all their efforts, but I'd eat them up like a piranha. So I finally, after my daughter's death and almost losing another one, and praying, "Lord, just show me what's going on," I got some help for myself from Dr. Robinson, and he said, "Well, praise the Lord that you ground your teeth off." He said, "You've been trying to get your jaw out there so you get your tongue out of the back of the throat. You know, if your tongue is attached in the front and you move it forward and you can get those front teeth out of the way, You'll live. And I did. I was struggling, but I still was living. He made the boat ramp to get up out of there, and in 2 days it changed my whole life. What I'd been trying to do was to at least get the jaw forward. So you build a nice case of Crown and Bridge, all cosmetic and beautiful, and if you've got them locked in there, they're going to destroy it, or try to, or they're going to die, or they wish they were dead because of the problems. Now we're talking some serious stuff here, because we can make or break many times the overall health issues if we know these facts. And so basically, this phone keeps talking to me all the time. So we pay a price for some of the technology. I have to wear this thing. I have to listen to that or cut it off. But the deal is, it's the difference between me coming in here today and seeing one patient after another that this works on. This is just as predictable as the sun coming up. I'm sorry that I don't have dozens of peer-reviewed articles to give you. That's your job. But mine is, I feel like Paul Revere. I'm running through life trying to get people's attention before the good Lord takes me home. I don't want to not do the right thing. And it's like the watchman on the wall. You know, it says if he doesn't shout the alarm, everybody's blood's on his hands. And so, you know, what you do with it's up to you. But don't wait for the peer-reviewed articles. Just go in your office and find who doesn't or shouldn't be taking some vitals before you start on a patient. You know, you're going to inject a vasoconstrictor in there, and they've got plenty of it because they're choking. And you go to lay that patient back, and they're already full of adrenaline. They're going to feel fearful and scared, and it's not up here, it's right there. You laid them back, the tongue's back there. And if you're going to put that person to sleep, look out. Everything that you think should work usually works backwards. My daughter had her tongue way back there, and I'd give her Benadryl to help her sleep, and it would keep her awake for 2 or 3 weeks, because her body was saying, hey, look, this is a death and life situation. And even though that's trying to put me to sleep, I'm going to squirt out some more adrenaline to keep her awake. So when you see these opposite responses, we gave her Paxil, which was for anxiety. Side effect is anxiety. Guess why? Because the body doesn't want to relax. The body needs all that adrenaline to stay alive. And you give enough to these people, the body is going to create anxiety and suicide. So I will tell you, nobody likes to live with that monkey on their back. And you need to be aware that we're able to help people tremendously. It's right under our nose and their nose. So you see, Joan Drawd, my English teacher just rolled over. There's a groove down the tongue, and sometimes you can even see it just doesn't get in there. It's folded over. It looks like a butterfly with the wings closed. And you put an appliance in there, that butterfly comes out, and there's total transformation of personality. This person that was so quiet now talks, or they're so talkative you can't get a word in edgewise. They slow down a little bit. The person's really angry and very all about business, starts joking. You've changed that person's life because you've given them cut. Because no air is death. And they've been living somewhere between no life, which hasn't happened yet, and struggling in survival, full of adrenaline, to just eke out something less than the abundant life. And all of a sudden, they have this metamorphosis of what they can be. And we see it so much so we got butterflies around the office. And I tell patients, I say, look, when you feel that we have accomplished the goals that you've set, I want a chocolate cake or butterflies. And fortunately, unfortunately, I get some chocolate cakes. And but the butterflies are, it's a say-so. I'm telling you that you have accomplished what I set out to do, is to get my husband out of the kitchen and me back in there driving again and having a life, or the husband going back to work because he couldn't get off the couch because he just had this fatigue and his pains in his head, and he just didn't feel like working out. And all of a sudden he feels like, I could take a walk around the block. I like that fresh air. He likes it because he can get it. Before, he'd walk around the block and he's struggling to breathe. And so we're talking about something that's fundamental to life, and you can really be a part of this change, this paradigm shift, this revolution that dentists play a big part in helping these people get to where they're more productive and enjoying life and serving others rather than just trying to selfishly get their next breath, and they don't even know it. It controls them instead of them or us helping them control the situation and not be a victim of just treating a symptom with this drug and that drug. You're getting closer to the core issue. We're not there, and it's going to totally change again and again and again. It's nothing set in concrete. But you need to know that this thing is something we deal with every day anyway. So I'm excited for you, and I'm excited for dentistry to make this big shift. Cosmetics, great. Breathing's better than cosmetics. It's not exclusive. We just have to do these things with the functional aspects and keep that in mind. I guess that's a good stopping point.